the Western Regional Health Directorate has raised an alert in 9 communities in the Shama district following the suspicion that dangerous gases have been released into the atmosphere from the Anto-Aboso explosion last weekend. The Health Directorate has issued directives to residents in these communities to immediately report any anomalies with their skin and respiration for immediate attention. Deputy Regional Public Health Director Dr. Gifty Amugi indicated in a public health emergency response meeting the explosion may have possibly been caused by a chemical which could result in inflammation and itching when it comes into contact with the human body.
This more they crack and come. And so there's all health directorate that there's been a chemical explosion at the Gravodo sub-district. That's the ant. They got torn into pieces. And then, yes, so that is what happened. And so the very next day, I think even started at dawn from where the site, if it was very near, it would have been a terrible disaster because it would have just abrasions and all that. Then back pain, waist pain, and all that are also being reported. For the deaths reported, we see that we are matching the cases as to the number of deaths by age. So we'd see that for most of them that were working there, they were in their youthful age. So we see most of the 50s to 59s that died. The head, their manager himself is dead. The cashier too is dead. So he's gone with the money. No, I hear the money flew and community members collected. So there's no money. But we don't know what we'll find. But at least we found 6. The 6, 3 are Ghanaians, 3 are Chinese.
Dr. Amugi also indicated that officials are actively engaging the public and disseminating vital information to prevent further community exposure to harm. She's also been advising companies operating in the highly industrialized region to properly manage hazardous chemicals.
I think when Apiete happened a year ago, it was an eye-opener for Ghana. So that was the first kind of chemical explosion that had ever occurred in the country. But not only that, but for Western region as well. But Western region is highly industrialized. And we learned a lot of lessons from Apiete. We had a lot of investigations into the kind of chemical and whether it was going to have an impact. And we were able to have a good closure on that one. This is also a whole new ball game altogether. It's telling us that as a region with so many industries and different kind of things being done, we are working with different kind of chemicals and different interplays at so many times. So we ought to be more cautious. But with this one too, just as the way we rapidly responded as health service to the Apiete disaster, that is the same way we are also responding to this one. We, together with the other services, the police, the DCE, the assemblies and all that, have come together, been able to condone the area. So it's off limits for the general public. We are continuing intensively with sensitization of the public on avoiding such contacts and also how to early detect such symptoms and then report to the hospital. So all these things are going on together with the response or the investigations also to the events that has happened. So in terms of emergency response, we had the tremor from the explosion actually affecting about 3 of our CHIPS compounds. We have gone around the 9 affected communities within the Shama district, redirecting them to their nearest facilities that are safe. And we've made provision there so that when they go, they will be able to get the needed quality services without any compromise at all.